Dr. Katie, hey,
Yes.
good to see you again.
Hello, how are you?
Hey, you know, believe it or not, we actually had a viewer for our new video channel write in and ask a question.
Oh, good, we love questions.
So I thought to myself, since this is, after all, the
I
Ask
get
Dr.
questions
Katie.
everywhere. I get questions at church, at the grocery store.
Right. And I know that you love those. That's good.
Yes.
But Jimmy, one of our most preferred clients, wonderful guy, had a question because he noticed he was driving by the Walgreens and he noticed these little vaccine clinics, and one thing he thought to himself was $10 for rabies. That's really cheap.
Seems pretty cheap.
Now, but here was what he did. What the interesting me was, and I want to get your reaction to, was he looked on his bill because he had just had a yearly with us, and realized we only charge $7.
Our vaccines here are actually less expensive.
Well, that's
than
what,
Walgreens Park.
yeah, and I, didn't necessarily realize that. So Jimmy's question was, why do we do the wellness exam? Now, he's not complaining. He loves Dr. Katie. That's not the point. But why why the wellness exam, and what is it that we're really looking for, and what does it do for us?
Well, Jesse here is actually here for an exam today, so we can go ahead and do an exam on Jesse and talk about why it's so important to do an exam on your little furry friend when we're going to give vaccines. The primary reason we do exams on dogs before we vaccinate them, and I'm talking about a thorough exam. I'm not just talking about pet your dog.
Like an eyeball,
shot
right, the eyeball
and
exam.
get to the next dog in the parking lot. I'm talking about a really thorough, good exam.
Right.
And the reason we do that is, first of all, especially in the case of rabies vaccines, it's very important to make sure that the pet's healthy before you vaccinate it. Vaccines are not benign instruments. We think of them as very routine because we give them all the time. But a vaccine actually stimulates the immune system. And if your dog has something underlying that's making them maybe not feel so well, but you wouldn't necessarily pick it up without a good exam, for example, jaundice and other conditions like that, bruising, bleeding disorders, maybe their lymph nodes are swollen because they have an underlying viral disease or something like that. If you then slam their body with a vaccine, you can actually make them quite ill. So the number one reason we do exams on these guys before we give them a vaccine is to make sure they're healthy enough to get the vaccine.
Okay.
With rabies vaccine, it's federal law that they have to have a complete exam before we vaccinate them.
Okay, so we're also doing it for legal reasons.
We're doing it for legal reasons,
Okay.
but the main reason we do it is we just want to make sure your pet's healthy before they get a vaccine.
Well, and you mentioned a couple things there a second ago. So tell me, what are some of the conditions that you would be able to pick up? I mean, obviously you're a trained expert, so you're looking at the animal. If I look at this, you said it's Jessie, right?
Doctor, but I play one on TV.
Yeah, but if I look at Jessie, then I don't necessarily, she looks okay to me. She looks pretty energetic.
Well,
but what are some of the things that you would find or could find in an exam from, again, just the exam itself?
Well, remember what we've said before is dogs are incredibly good at hiding illnesses and hiding sickness because, let's face it, the way it works out in the wild is if you limp, your lunch.
Right.
So the animal that's ill out in the wild wants to hide it because predators are always looking for the weak one in the herd. And if they can find an animal that's not feeling well, that's going to be the one that they go after. And so dogs are extremely good at acting like everything's okay when it may not necessarily be so. So when we do an exam, when I go to do an exam on a pet, the first thing that I do is a kind of a systemic, stepwise fashion to make sure I'm not missing anything as I go. So we always go from nose to tail. That's one of the ways that I approach it. So what do you think, Jess? Are we going to do an exam? Mm-hmm. She's very bored.
So, and as you go along, are you going to tell me some of the things that you could be, because she may be perfectly healthy, but tell me some of the things that you could notice that, again, even if she isn't showing the sign, tell me some of the things that you could actually find.
Well, the first thing we do is we start with the nose, and what that means is I look at their little face, say hi there, and what I'm looking for is things like symmetrical. Does the two sides of her face, do they look the same? That might seem very simplistic, but there's actually some neurological things that can happen that can cause their lip to droop on one side. Are both of their eyes nice and clear? Do I see anything in her eyes or the white of her eyes that
So
makes
no drug use, is
no
that it?
drug use, yeah. Are your pupils dilated?
Not like the dog that came in the other day that vomited up the ashtray worth of something. Yeah, we'll skip that, right?
Like that, but it's usually not
Yeah.
voluntary.
Yeah.
But one of the things we do look for is, are the pupils the same size? And that's one of those really subtle things that actually can have some bearing on whether or not we vaccinate for rabies or not. If I've got a patient that's showing any kind of neurological signs, if her pupils are funny, if I look at her eyes, there's a condition called nystagmus where their eyes actually can have a little bit of a tick back and forth. If I see anything like that, I'm probably not going to vaccinate for rabies that day. I'm going to want to get into the bottom of what's causing that.
Maybe
So-
I should be checked too, because maybe that's why I have a hard time reading. What is that little? What is it called? Tell us the condition again.
Nystagmus. You'll have you
Okay.
just see bifocals because you get old. It's nothing to do with that. But what we do is we also, when we look at their eyes can actually give us a ton of information. Besides neurological things, when I'm looking at the white of her eye, sometimes dogs that are starting to have a problem with their liver, they can actually start to turn yellow. They get jaundice just like people.
Ah.
But one of the very first places you'll see it on a dog, obviously skin on people, but dogs are covered with fur, so it's a little more challenging. But you can look at the white of their eye, and the white of their eye will actually start to turn yellow. So that can be one of the first places where you'll see jaundice in a dog. I can see if there's bruising on the eye, and that could make me think about if there's a clotting problem. And also I can see if the eyes have a proper tear production, if there's a nice shine to the eyes, make sure that the corneas look okay, is there any discharge there. So that can all give me some clues as to how they're doing overall. Next thing I look at is there any discharge from the nose? Are the gums nice and pink? Are they moist? Certain kinds of dehydration will make the mouth really dry, so you can check, and she's bored. You can check and see if there's any abscess teeth in there. Is there any bruising on the mucous membranes? Is it turning yellow in there? In the case, again, with liver disease, you can actually see jaundice starting on the inside of the lip. And we can get a kind of an idea on how blood pressure is doing and those kind of things just by looking in the mouth. So we really haven't gotten very much further, but we've already gotten a ton of information.
Sure. Okay.
So then we work our way back. We're looking at the ears, making sure the ears are nice and open. Make sure there's no mites or parasites or pus or anything like that. Make sure the color of the ear, again, if the ears are really pale, if there's bruising in the ear, if it's turning yellow, you can determine all kinds of metabolic diseases from that. Of course, that's a nice, healthy ear. Okay. I go to under the chin, and what I'm doing now is feeling lymph nodes. Make sure her lymph nodes are nice and small. There's no swelling that shouldn't be there. Run
And
down
she
the
seems
throat.
pretty well behaved. I imagine not all dogs are this easygoing about the
You know,
exam.
you'd be surprised. Most of them really are.
Really?
If you go real gentle and you kind of make it kind of a little bit of a game for them, you know, where you're scratching them. You can see my fabulous nurse assistant here is...
Right, Miss Stephanie.
Miss Stephanie is petting
Who's
her and
hiding from the
scratching
camera.
her. And what I'll do sometimes when we reach this point in the exam is I'll start scrubbing the belly, because then I can see her abdomen. And again, I'm looking for things like skin color, bruising. Does she have anything on her fur that has me worried? Does she have any crusts or scabs or anything like that that might indicate like a staph infection? Any flea dirt, any fleas crawling around there? Does she got good abdominal tone? Does everything look okay and normal? I check the bottom of her feet, make sure that we don't have anything going in our pads that we need to worry about, make sure that her nails are all healthy. Sometimes on little dogs that don't get their nails worn down by running around outside, we'll actually see nails growing into pads, so it's very important that those feet get checked and make sure that there's nothing like that going on. Then, girl, I move to the abdomen. And basically what I'm doing is I'm palpating the abdomen,
Okay.
which means I'm just feeling her stomach to see if everything feels like it's supposed to. I've done about 10,000 of these, so I have a pretty good feel on, you know, hey,
And when
what
you
is
say
that?
it,
That's not supposed to be
does
there.
it? Yeah. When you say that, what are some of the things that aren't supposed to be there?
Well, for example, I can sometimes just run my fingers and actually feel a mass in there, unfortunately.
Okay.
Sometimes they're benign, like I can feel a mass on, say, the spleen. I'll just put my hands here at the level of where the spleen is at, and I can say, that doesn't feel like that's supposed to be there. So lumps and bumps. Sometimes you can actually feel bladder stones in the bladder. they feel like kind of like rocks or Rice Krispies up there in the bladder, and when you feel that, you know, hey, that isn't right, maybe we need to take an x-ray. So it gives me a lot of preliminary clues as to whether or not I need to do something more extensive. I've actually had several dogs that have come in for vaccines, and we were able to detect the mass in the abdomen and do something about it, instead of just finding it out later if the dog was bleeding out or doing something real scary like that.
So by catching it early, you're able to solve the
Yes,
problem and give
yes.
them a much longer period of life.
Better
And
to
right,
give your
of course.
veterinarian as much time as you can give them.
Well, just like with humans, it's the
Just like
same
with
thing.
people,
Preventive is
you know,
better.
Unfortunately, sometimes when the patient's brought in, we kind of have a mess, and it's much harder for us to deal with things and put Humpty Dumpty back together than if we had a little bit of extra time
Sure.
at the beginning. So we really try to do a lot of preventative medicine. If you find a small mass, it's much easier to remove than when it gets gigantuous. And it's easier to treat a liver problem if we catch it really quickly when they're just starting to turn yellow, as opposed to now they're vomiting, diarrhea, not eating, that kind of thing.
Right. Okay, so those are some of the key things. Now, what else? I mean, obviously, we've worked our way back. Is that the extent of the exam, or is there still more to it?
No, what the next step is, we're going to want to use a stethoscope, and then I'll listen to their
Yeah, so
heart.
this is not something that's just a routine little run your hands over them for 1 second. This
No.
this is good.
You're experienced veterinarian, which I'm sure a lot of you have very good experienced veterinarians. They get very, I don't want to say routine, because no exam is ever routine, because every dog is like a fingerprint. They're all unique.
Of course.
But you do get very practiced at what you're looking for. And so I can actually do a pretty thorough exam in about 3 to 5 minutes.
Okay.
So what I'll do at this point is I'm feeling the axillary lymph nodes, making sure they're nice and small. I'll listen to her heart and her lungs,
Okay.
and make sure that I don't hear any murmurs or beats getting skipped or anything funny in there. Make sure the lungs sound nice and clear. And we'll go ahead and do that real quick. We're trying to make sure we're not missing anything. She thinks this is all play. Yes, I know. The big challenge with them is wiggling. Yes.
Kind of messes up hearing the heartbeat and the rhythm and all
They're
that.
growling, and it's pretty loud in the stethoscope. The other thing that's kind of a neat little trick that veterinarians use a lot is it's called checking digital pulses. And what it means is when I'm listening to her heart and I'm feeling her pulse back here to make sure they're synchronous. And you can actually detect different types of heart disease and thromboembolies and different types of clotting problems by
Wow.
doing that.
You know, I have to note while we're finishing this up that our viewer that wrote in, Jimmy, noted that the commentator needed some additional training help. So I just want him to know that that's really broke my heart. Broke my heart.
Oh, I think you're doing fine.
I hope for our viewers you all realize that this is all about giving you information, and
But
hopefully
we're not trying to win an Emmy here.
that's right. Hopefully in a very efficient way, so that you can understand what it is that we're doing with animals when we're in the back, and why it is that certain things need to be done, and in this case, of course, the importance of a really thorough exam. And Dr. Katie, and this is something that you recommend at least once a year, right? An exam is done once a year?
thorough exam at least once a year.
Okay.
Dog's age. You really can't use the old monker 1 year is 7 years for a dog, but it's not far off.
Okay.
You know, they age quickly. They only live, average lifespan is 12 to 17 years, 15 to 17 years, and larger breeds, of course, don't live as long. Younger breeds smaller breeds that are mutts tend to live a little bit longer. But you do want to check for changes at least once a year, because again, you want to catch it quickly. So we
Right.
need to do something.
Right.
She's so lazy. Oh my goodness.
And what you're doing now with the hip area, what are you checking for there?
What I do now, we've worked to the back end, and what I'm doing is I'm checking for things like fleas, scabs, raw areas on her hair, on her skin. I'm checking her little perianal area to see if there's any growths or parasites back there. Not wanting to be gross, but that's what we do. And then when I get to their back legs, I'm looking for things like, is there any crunching or creaking back here? Do we have any arthritic issues going on? A lot of little dogs have loose kneecaps, and most of the time it doesn't cause them any trouble, but it's a good thing to note in the record. and then things like that. And then when we're done, as long as everything looks great, then at this time we go ahead and do a vaccine.
Okay. So that is why an exam is done before we vaccinate, and also in general why an exam is a really good idea to do at least once a year with a good quality veterinarian. So thank you, Mr. Jimmy, so much for your question. We appreciate you taking the time to write in. And of course, as always, thank you, Dr. Katie and Miss Stephanie, for your help in today's Ask Dr. Katie segment. So everybody have a great day. Thank you.